So we're here with Dawn again. It's now 1 week after the operation, and she's here to remove her stitches and staples, and that's all done. So first of all, you're telling me you're not wearing any glasses, which is good.
And well, when I saw and talked to you in the before surgery, I told you I never go anywhere without them on.
Right. So
And
now you're
off.
sitting underneath the fluorescent lights.
And they're off.
And they're off. Okay, well, that's a good thing. Can
It's a
you
lot better.
tell us what's happened during the past week?
Well, surgical
have you
pain
felt?
is really bad.
Yeah.
Warn everybody now, it kind of sucks. But my shoulders have been from maybe a 0 actually to a 3 pain level, which I've never had. Even after injections, they've always been hurting or didn't last very long.
Okay.
But it was never a 0 after any procedure ever.
And it's now 0.
Yeah.
That's fantastic.
I mean,
Okay.
I'm not, pressure points don't hurt anymore, which were really huge for me. I was even diagnosed with fibromyalgia, which obviously not so much now.
Right.
Because I was pushing.
Maybe it wasn't the right diagnosis.
Right, I'm thinking that it wasn't, because pushing on the trigger points, even in my neck, you know, doing one of these to see if they were tender but not painful at all.
Good.
So that's a big thing. Nothing really triggered in my eye, which was one of the big pains that I had pretty much daily. And with really bad weather the last week, that was one of my major trigger points, is the weather. And
Yeah, we should tell everybody that we've had very unusual weather.
yes,
Here we've had rain, we've had
actually
cloudy days.
50-mile-an-hour gusts yesterday.
Exactly,
So,
and this is southern Nevada, so it's
and
a little unusual.
the
Yeah.
wind was always, even at 15 miles an hour, would always overcast or whatever would trigger my migraines. It was one of the big ones. And even then, it's like maybe the max was like a 5. And for me, I even told you, I can live with that.
Right.
But I don't really want to. You need to do these.
Right, so we discussed before. She has multiple trigger points in the forehead. There's trigger points in the temples and the forehead area, and we have released just the back of the neck because that was the first one and the most major one for her.
But it's not triggering them. My eye pain is bad.
Right.
I mean, I still feel it. You know, a lot of the times I couldn't even barely open my eyes because it would trigger so bad in here, or I would just want to dig out my eye or whatever. And it's triggering it, if any, just really less. And the temples, yeah, I mean, they're not even really tender where before I couldn't even touch them without cringing.
But if we concentrate on anything that's coming from the back of the head for today.
Yeah, it's not. That's why I say it's not triggering here, and it's not where this was so painful and down my arms, and I have, which was really strange. It feels like I have more strength in my legs, because it does, and in my hands, because my hands are always like getting cold and numb and tingly. That it doesn't seem like that is the case as bad. I know it's not 100%, but it's.
And it's
so
only
much
been
better.
a week.
Yeah.
Okay, so and like you were saying, the surgical pain and all that, and you're healing and all that's still going on.
Yeah, the surgical pain is.
What's amazing is that when you remove even just one of the trigger points, and you have many other ones that we're going to work on later, but you know, the effect of removing one trigger point is way bigger than just headache in the back of the head.
Yeah.
So it's a global advantage, which
Well,
is
because I also
fascinating.
feel that I don't need my facets done anymore. Because that was, a trigger point right there where he was doing between 3 and 6, the facets right in there.
Right.
And I don't feel like they need to be done.
Right.
Which I was getting those done every 3 months.
Right.
The injections that would put me down for a week of recovery time from the pain of the laser, because he was burning them.
Right.
And that was really painful.
So hopefully that's over and you don't need any of that anymore.
Right, and I'm hoping that, decreasing the pain meds and all that will be more active for me and, better for my body anyway, but.
Sounds good.
So when can you do these?
We'll get to those. Well, thank you very much.
Thank you.
And it's a continuing journey and we'll take care of the rest of it.